Welcome to Adapting Class 85 NCLEX practice question high yield. These are commonly tested questions based on recommendation from those who've taken the test. I compile them based on the recommendation, and you're going to get everything that shows up on the NCLEX in a random way. So you don't know what you're going to get. Stick around. When you pass this, you're ready to go. Let's get it done. I set it up like the computer adaptive test. You don't know what you're going to get. First question is right there. As you can see, prioritization. What are you going to do? A nurse is caring for what? For client. Which client should the nurse assess first? Prioritization 101. Use B sharp and you'll be golden. How do you do B sharp? Divide the question into two and find what is the problem and compare them. That's all. And this is the way I will read it. Client, right? Abdominal cramp after receiving dicyclomine. Is that what you expect? The COPD patient, his saturation is what? 88 after walking. Bilobar pneumonia. I don't care. It's just pneumonia whose oxygen saturation is 89. Room air. Do you think you should worry about it? Asthma patient reporting about shortness of breath after receiving Abodro. Then you ask yourself, what can I do? Prioritization. B sharp, not expected. What is that? Breathing, electrolyte, shock, sepsis, hypothermia, hypoglycemic, airway, neurological, and pain. What do you have? Abdominal cramp. If I give you dicyclomine, it's an expected finding because it's an anticholinergic. COPD patient, if you walk in, your saturation is supposed to drop, unexpected finding. If you have pneumonia, your saturation is not going to be 100, 89. There's no symptoms. By default, number 4 is your right answer. What do you think? Asthma patient, if I give you Abodro, you should do better. What is happening? Shortness of breath. Bad problem. Bad problem. Bad problem. We need to see that patient. Patient is not doing well. Number 1 is that. A concept question. Concept related to what? Kawasaki disease. And nurse is caring for what? 5-year-old child diagnosed with what? Kawasaki disease, who just received what? IV immunoglobulin. Which vaccine should the nurse advise the parent to delay? In every question, I'm going to give you the concept, and I want you to take a pen and paper and write it down. As you know, I like concept. If you know concept, you can answer the question easily. How do you answer the question? Go back, figure out the buzzwords, and use it to answer it. Need to delay. About what? Vaccine. Why? I'm a 5-year-old. What happened? I have Kawasaki disease. And so what? I receive immunoglobulin. Oh, okay. Immunoglobulin, you should not receive any live vaccine. Which of this is a live vaccine? Nasal flu vaccine, DTaP, hepatitis B, polio, right? IPV. Which of this is a live vaccine? It's a concept. I want you to write it down. If this is difficult, I want you to go back to Adapting Class. You get videos, watch, and master it. Which of this is a live vaccine? I can tell you, you can put down the answer in your comment. Let me know. Hashtag live vaccine. Which one is a live vaccine? Nasal flu is a live vaccine. The IM one is not a live vaccine. DTaP is not a live vaccine. A B is not. Polio, IPV is not a live vaccine, but the oral form is a live vaccine. Therefore, we're going to give this patient, tell the patient to delay nasal flu vaccine. That's our right answer. And another healthcare provider are performing to rescue CPR on a 3-month-old infant. This is a cardiology question. After I read the question, I will tell you where it's coming from so that you can write it down and then go read about it, more concept. which action is appropriate. CPR for a child, but look at it. There's a buzzword there. What is the buzzword? 2, rescuer. That is your buzzword. Therefore, what do you know about CPR involving 2 people? That is the concept. 30 to 2 compression to ventilation rate. Compress the chest to what? A depth of what? 2 inches. Pay attention to the 3-month-old. Deliver compression at what rate? 100 to 120 per minute. And check the brachial pulse for 20 seconds. Stop the video. Everyone, stop the video. Then you answer the question. Then you see the way. This is how you can use this video to teach yourself and master the concept. But I can tell you what? Compression of 20 to 2, compression to ventilation rate is used for a single rescuer if you are an infant. Therefore, that is the wrong answer. For 2 rescuer is 15 to 2, and that is wrong. Compression to the chest of 2 inches, a 3-month-old, that is too much. All you need is what? 1.5 inches. That is all, or 4 centimeters. This is wrong. The delivery compression rate for everybody is what? 100 and 120. And the brachial pulse is fine, but 20 seconds is too long. You should limit it to what? 10 seconds. Therefore, our answer is what? Number 3. This is the way I want you to go through and analyze each question. And this is the reason, as usual, these are all coming from my Q bank. But these are recommendations from students, and I pile them up, compile them up, and make this video. And nurse is caring for 4 clients. Prioritization. Like I said, this is random one. And every question, you don't know what is coming. Like you are in simulation, taking the NCLEX. Which client should the nurse assess first? Prioritization 101. A client with what? Documented latest allergy who just arrived from the OR with the what? Foley catheter and multiple drains in place. Do you want to see this patient? Ask yourself. A 2-hour post-thyroidectomy, yes, thyroid surgery, who will report what? A tight feeling in the throat and has a hoarse voice. Do you want to see this patient? A client with a heart failure is reporting what? Shortness of breath after receiving 1 liter of normal saline. Do you want to see this patient? Sepsis patient is getting vancomycin and is reporting about itchiness and facial flushing, a bunch of things going on. These are all the B sharp around it. I have a latest allergy, and I came back from the surgery and I have a bunch of Foley catheter and multiple drains. Yes, the nurse need to see this patient. There is no latest product be given to the patient, so she need to verify that. Let's go down. 2, thyroidectomy, tightness in the throat and hoarseness is a bad problem. Bleeding or airway, this is bad problem. Heart failure, shortness of breath. You have a breathing issue, while this is an what? Airway issues. This patient is breathing issue because his fluid is fluid overloaded. We have to stop the fluid. Therefore, which one you want to see first? And then vancomycin, receiving what? In a patient who has sepsis, having what? Itchiness and flushing. This is Redman syndrome. As you can see, we have time for Redman syndrome, and we have time for the patient may have latest allergy, but there's no evidence of what? Airway issue at this time. Between the breathing issue and the airway, who is feeling tightness, I'm going to see B. I don't know what to choose, but you have to prioritize. This patient is having symptoms right now. C is also having symptoms, but the problem is because they get too much fluid. But the second one is bleeding and it's obstructing the airway. Air cannot go in. C can still breathe because it's a breathing issue. When you have problem with the tubes, which is the airway itself, is different from your lung. It's not the lung problem, it's the actual airway, which are tubes, and that is what the patient is suffering from. Number 5, what is your score so far? This is Pete, random Pete, right? Don't worry, I got you. I'll give you the normal finding. So pediatric nursing is the next question. Write it down. Try to answer this one because they are high yield facts. You can't run away from it. 11-month-old infant in the pediatric clinic, which finding below is concerning. That means unexpected finding indicate presence of moral reflex, positive Babinski, poor suckling, 10 wet diaper in the day, poor feeding, crying when the caregiver leaves the room, and cannot sit unsupported. Which of these should worry you? We are in the next generation NCLEX. Please don't pick things you don't know. If you are 100% confident, pick the answer. But if you're not, leave it alone. It's select or apply. You don't have to get all the points. Pick, if you know 2, I want you to pick 2. If you know 3, pick 3. And the rest, run away from it. What do you want to pick? Which of these are concerning? That's all. Presence of moral reflex. It's supposed to be gone by 3 months. You're 11-month-old. I'm worried about you. Babinski, it can stay up to 12 months. We're good. If your suckling is poor, maybe a neurological problem. 10 diapers a day, you're good. And if you're not feeding well, we have a problem. If your mommy leaves and you cry, good luck with that. Cannot sit unsupported. I don't like it. 11-month-old, you should be able to achieve that. This is pediatric. I have a playlist for pediatric. I have a bunch of videos. If you go Ped Nursing, NCLEX practice question, you get a bunch of adapted NCLEX video, or just check my YouTube site and you get a bunch of videos and master this pediatric newborn stuff, and you'll be golden. So those are the things we should worry about. And this is my favorite question, critical thinking. A nurse is performing an admission assessment. Which reported allergy should the nurse prioritize? Patient is coming to the hospital and you're going to ask the patient, do assessment, and they tell you this information. Which one should you prioritize? Cowic allergy, banana, avocado, chestnut, papaya, and latex. What do you think I'm telling you? The clue is in the latex. Or if you have all allergies to this, remember, hospital is full of what? Latex. Everybody who come in, we got to figure out if they have latex allergy. So it's that. But why do I care about fruits? The reason why I care about fruit is what? It's key, right? And I call it latex love tropical fruit and nuts. That is your buzzword. If you don't know this at all, I want you to know this, right? Latex, right? Latex love, I call it latex, it love tropical food and nuts. That's all. Therefore, if you see anything that you know is a tropical food, then you got to pick it because it has latex and protein in it that can cause latex allergy. Kiwi, tropical. Banana, tropical. Avocado, tropical. Chestnut, tropical. Papaya, tropical. All of them are tropical foods and nuts, and they all have latex allergy. Know them, and that's the buzzword. Latex loves tropical fruits and nuts. These are something I want you to know. Commonly tested questions you may see on the NCLEX. They show up, the board favorite, based on recommendation. I put it together. Commonly tested questions on the NCLEX. Watch out for that. Of course, you have to know this, right? This is the classic question. They may not tell you what it is. It's a PED question. It's also infectious control. Look at it carefully. A nurse is assessing a 3-year-old client, okay? An infant is what? Febrile, right? The kid is what? Febrile and lethargic. What is going on? The scalp with what? Widening of the sutures and engorgement. Which of the following the nurse should anticipate in the plan of care? Select or apply. You have a 3-year-old, and when you see them, they're febrile. and they are lethargic. And when you look at their head, there's sutures. That's the line between, if this is your head, the skull, there's sutures, right? These are separated, they're widening, and the veins are engorged. This tell you is what? ICP. These are all ICP related. What condition will cause an ICP related? You have fever and lethargy. This is what? Meningitis. One of the hardest questions in the whole test that you're going to take. This is practice test. One of them, the hardest one. What do you think? Meningitis. Now, I've given you the diagnosis. What would you do? Patient has ICP issue with meningitis. Well, all bed rails should be raised and padded because of seizures. Negative pressure room, meningitis don't go into negative pressure room. Droplet precaution, of course. Meningitis. Suction at bedside, yeah. So that if you are spreading or you seizing because of ICP, I have suction at bedside. I should not report this to the authority. This is not abuse. Scalp widening and engorged vein and febrile, those are not abuse. Patient is in trouble, is having ICP issue, and therefore these are our answer. Classic meningitis patient. Number 8, which prescription from the healthcare provider the nurse should clarify? Read it from the back. Therefore, I'm talking about prescription, right? A nurse is caring for a client with mania on lithium, pharmacology. Pharmacology related to what? Lithium. Which one should you question? That means you should not take this medication when you have lithium. Should you take bupropion if you're on lithium? Should you take risperidone? Should you take valproic acid? Should you take Motrin? Should you take what? High calorie diet? What do you think? You have mania and you're on lithium. Of course, I need to give you a bunch of high calorie diet because you're maniac. We need energy to fight. Should we do that? But the question said, should clarify. You see the key? Yeah, we're good. Should you take Motrin? If you take Motrin, you're going to affect your kidney. If you take Motrin, your kidney is in trouble. Why would you make your kidney in trouble? Hey, the lithium is going to become toxic. You should not do that. Valproic acid. A is a mood stabilizer. You can use it for mania in a patient who have bipolar. That's good. Risperidone, you can use it in the patient who have mania. Bupropion, A, it will give you strength. It will make you hyper. Lithium, bipolar patient who is in mania is hyper. Why would you give somebody who is already hyper something that will cause them to be hyper? Bupropion is unaccepted. Therefore, which medication you should clarify? Bupropion and Motrin. They need high-calorie diet for the mania. Valproic and risperidone are used in patients with mania to treat bipolar. And this is assessing a 12-month-old. Like I told you, pediatric newborn is a must. With finding, need further workup. Select or apply. That means growth and development. How do you know them? Check out Dr. NCLEX, a bunch of video with mnemonics to make it easy as much as possible. Which of these should need further workup? A 12-month-old, still has crude pencil-graph. Pencil-graph should be like really fine by this time you are 9 or 8-month-old. This is a problem. I don't like it. Sitting from standing position. Oh, you can stand and then sit down again. That's good. You're doing great. Anterior fentanyl can take up to 18 months. I'm not worried about it. Turning 2 pages of a book, 12 months, you should be able to start doing that. Diet include cow milk? No way. 12 months, you have to be more than a year before you do that. And therefore, those are the things I should worry about. How are you doing so far? This is question 10. Put hashtag number 10. I've reached number 10. If you reach number 10 too, thank you for getting there. Let's go. Which of the following the nurse should include in the teaching? Select or apply. Don't over-select. Once again, don't over-select. The nurse should provide a teaching to a client with what? Moderate insomnia. Which one should the nurse include? If you can't sleep, you should avoid caffeine before you go to what? Sleep, right? That's excellent. Keep the room temperature cool and noise-free. Okay. Woo, that's good. You should avoid reading in bedroom. Okay, that's good. Engage in moderate exercise 1 to 2 hours before bed. No, at least 4 hours. You're not going to sleep. If you take naps during the day, you're not going to sleep. You should go to bed and wake up every time at the same time. It's a good thing. Know this, insomnia, sleep, best care and comfort is coming. And one of them is sleep. And they love this kind of question. So know all the things. You can take a picture of it. These are the things you need to know when you want to improve insomnia. Anywhere you go, same thing. Never change. Now, as you know, case study. I love case study. It teach you to think critically, put everything together. So what we have? A lot of information. I got you. Don't worry. I'll show you how to read it. Read it carefully. Just brush it first and go for the key first 2 sentences. Alert unrated ×3. Patient is fine. Report dull and sometimes troubling calf pain after walking. Calf pain after walking, something is telling you. Like I told you, first 2 sentences should tell you. If you have calf pain and you're walking, that's claudication, right? Used to walk, what, 5 miles, but now you can only walk 1.5 miles without any issue. Pain is relieved at rest. It's confirming our claudication. Symptoms has been getting worse the past 6 months. The past 6 months is getting worse no matter what. Not able to play golf. Why? Because of claudication. There's no trauma, right? Vitals, respiratory rate, saturation. Good. Is smoke, risk factor, right? Decreased breath sound at lung basis. Well, if you smoke, I'm not worried about it. Lung basis is never a problem. It's always a trap. Whenever they give you a question and they say decreased breath sound at lung basis, don't worry about it. He has sleep apnea. Okay, you're trapping me. It has nothing to do with claudication. You see, don't worry about it. If they mention sleep apnea right now, why would you worry about it? They spend about 3 lines to talk about claudication. Ignore it. Blood pressure is high, right? Do you have hypertension? I don't know. Because of your sleep apnea, what is the heart exams? S1, S2 is present. It's normal. There's no murmur, right? Sometimes they'll give you so many information that is normal. Keep on going. Don't boil down. Cardiac bruit, none. But look at the right leg. The right leg is what? It's cold and hairless. Something is wrong. The +2 femoral pulses, right? And popliteal, if you go down, the pulses is lower, right? Popliteal, posterior tibia, and dorsalis on the right side. Look at the left leg, it's warm, right? The left leg is warm. The pulses are all normal, +2, popliteal, femoral, tibia, dorsalis, pedis pulses. Something difference between the right and left. Patient is obese. I'm not surprised. His abdomen is fine. His liver is not palpable. He has no edema. All this, I don't care about it. I know this patient has claudication. Now, what do? The nurse is formulating a diagnosis. Specify if the assessment finding is consistent with what? Peripheral artery disease. And they give you this. Which of these is consistent with PAD? That's all. Let me know if you think he's PAD. Beefy red ulcer, right? His leg, he has edema. It's a browning pigmentation, whole leg, toe ulcer, decreased peripheral pulses, pain improved with leg in the dependent position, and pain improved with elevation. Which of these is consistent with PAD? The way I say PAD is blood flow. There is no blood flow going to your leg. Therefore, if there is no blood flowing going to your leg, there's not going to be beefy ulcer. There's not going to be edema. You see, you don't have to make it difficult, just the word blood flow. There's not going to be browning pigmentation. Your leg is going to be cold because blood is warm. If there's no flow, there's going to be ulcer in the distal aspect. That's your toe. Your pulses is going to decrease. When you stay upright, your pain get better. Pain improve with leg in the dependent position. That's good. Pain improve with what? Elevation. That's not good. It's not consistent with what? PAD. Don't make it difficult. This is that Dr. NCLEX way dealing with PAD. This is highly tested. We already know what is wrong with this patient. Based on the clinical data, the nurse should suspect that the client is most likely experiencing what? Peripheral arterial disease. This is not chronic venous. This is not the DVT. This is not compartment syndrome. I will tell you pain is out of proportion or they're not responding with pain medication. There's evidence that this is peripheral arterial disease. Now, what do we have? Based on the data provided, which finding require immediate follow-up? Which one? Well, we saw that calf pain after walking. Should you worry about it? Smoking history. Should you worry about it? Blood pressure. Should you worry about it? Is femoral pulses is +2. Is that normal? Is posterior tibial pulses is +1. Is popliteal is +2. Is obese. Clue, write this down. If they said, which one should be concerning or need immediate follow-up, means you can do something about it. Cough, pain after walking, well, I can do something about it. I can teach them. I'm worried about it. They are smoking, well, it's not going to go away right now. So I'm not going to worry about it. Blood pressure, if you look at it, is chronic. It's not that bad. I'm not going to worry about it. It's peripheral pulses +2 is okay. I'm not going to worry about it. Posterior tibial +1, I can do something about it. I'm worried about it. +2 of popliteal is good. It's obesity. Well, good luck with that. We can fix it. So the only two is calf pain and then decreased pulses. Now what? The client was diagnosed with what? Claudication due to peripheral artery disease. Which intervention is indicated? That means management of claudication. What do you think? Pentoxifylline. This is used to open the vessel. It's like medication that will increase blood flow. Medication to increase blood flow. So that's what we use. It's different from aspirin. Aspirin is antiplatelet. It prevents platelet plug. So we give it to them so that they don't have platelet plug causing embolism. We got to teach them to walk, walking program. We got to control your cholesterol. Your sugar, we got to make it better. Do they need cardiac angiogram? No, until they know improve it. So you don't do that. This is what? Peripheral artery disease. I'm giving you every angle that NCLEX will give it to you. The client is ready for discharge. Which teaching provided by the nurse is appropriate? How do you teach PAD patient who is going on? Walk until you have pain. Rest briefly, then proceed walking. Wear open-toe shoe at home to prevent injury. Elevate your leg when in sitting position. Apply aiding pad to the leg to ensure adequate blood flow. Stop smoking. Stop smoking. Stop smoking. No brainer, right? Stop smoking. We're going to do that. Your leg, you don't feel anything. There's no blood flow. Don't put any heating pad there. Keep your leg in the dependent position, leg down. You shouldn't elevate it. You should not expose your toe. If you do that, you injure yourself. It's not going to heal. B is out. I want you to walk. Walking, you get pain, stop a little bit and proceed. This will help with what? Blood flow. The client reported to the emergency department 3 months later with diaphoresis. Now he's sweaty. He has abdominal pain. He's radiating towards the back. His systolic blood pressure is 90. Which condition is he complaining about? Remember, peripheral arterial disease is not just your leg. It goes from, if this is your heart, we have the aorta coming down, and you go to your leg. This also is aortic abdominal aneurysm. It's a form of peripheral arterial disease. So this patient now has what? Abdominal pain radiating towards the back, and the systolic blood pressure is 90. This is the AAA rupture. We have AAA rupture. That is the problem. Classic presentation. Remember, these are all interconnected. This is no myocardial infarction. I'm not talking about your chest. I said the abdomen, eliminated. Venous thromboembolism. I'm not talking about your leg. Lumbosacral fracture, of course. But the fact that your blood pressure is going down, I'm going to pick this. And this is the classic AAA question. Abdominal aortic aneurysm and peripheral arterial disease. Now, we are number 12. How are you doing? Same concept. We're going. If you're tired, I want you to get a drink. Come back. You can stop the video and come back and watch it again. But this is the concept, most commonly tested question you will see on the NCLEX. And then provide a care for a client with what? New diagnosis of bipolar. The client is now prescribed lithium. Lithium is going to show up. So take a pen and paper, write what we're going to talk about right now. Which teaching at this chart is appropriate. And stop the video, write it down. Drinking 2 to 3 liters of water a day. What do you think? Avoid NSAID as much as possible. Call the clinic immediately with nausea or diarrhea. You will need to take chlorothalidone for your blood pressure. Increase your intake of what? Sodium. Stay on what? Salt substitute. If you have lithium, there's a key thing you should worry about. Keep sodium normal as much as possible. Hydrate yourself. Prevent anything that affects your kidney. Those 3 things. Make your sodium normal. Avoid dehydration. Make your kidney good. Therefore, what is the problem? Which teaching is appropriate? Well, drink a lot of water. Good. NSAID is going to help if you avoid it. Call the clinic immediately when you have nausea and diarrhea. Well, number 1 signs and symptoms is GI problem. Excellent. You will need to take chlorothalidone. It's going to cause dehydration. Therefore, avoid diuretic. Increase your intake of sodium. I said keep it normal. Stay on salt substitute. That means you're not taking any sodium. Salt substitute is potassium. You should not take only potassium. That means you're decreasing your sodium. We have a problem. Those are our answers. And this is educating a client with prosthetic valve, prescribe what? Warfarin, 2.5 milligrams. Which of the following teaching indicate correct understanding as prescribed? Take your time, write it down, break the question down, figure out what we need to do. Correct understanding about warfarin and patient prosthetic valve. Connect the 3. Connect the 3. Prosthetic valve, warfarin, and what? Correct understanding. Well, warfarin, you should never change whatever diet, vitamin K dependent factors you're taking. If you have prosthetic valve, we want INR to be higher. It's 2.5 to 3.5, not this one. I will be consistent with the amount of vitamin K. I'm good. That's excellent. I will need at least weekly lab draw. You're good. You don't need this medication for 6 months, for life, so far as you have prosthetic valve, not 6 months. You should not decrease kale and broccoli because they have vitamin K rich diet. Therefore, if you stop it, if you decrease it, we're going to bleed. Therefore, don't do that. And therefore, what are our answer? Our teaching, we're going to do this, and then we're going to have a lab draw. And that's the explanation for that. So B and C are your right answer. And let's review the client statement. Which alert statement require follow-up? They're saying something bad. Same thing. This is built on the same question, right? And then she's talking to a client, prescribe what? Dabigatran for VTE. Client report the following due to the new prescription. They drink 2 to 3 liters of water a day. Client stop taking fresh living vegetables. Client is using razor blade for hair clipping. Toothbrush is bristle in nature, and he has alert bracelet. And what? The client take Cilium, Motrin, prednisone daily. Client is engaged in contact sports. Recently, client started oral contraception due to the medication. I'm trying to give you all the questions they will ask you in the form of a case study. I made it like that. Therefore, what do you think? Which one? The question says, which highlighted information should the nurse require follow-up? Then you go back. You said, well, dabigatran, what do I need to know about it? Oh, drinking 2 to 2 liters of water a day is good. It prevents dehydration and DVT, right? Stop taking your fresh living vegetables. You don't need to change your diet. So we got to worry about it. Razor blade for hair clipping. I want you to use clippers, not razor blade. You're going to bleed. You see, that's the strategy here. This patient is going to bleed. Toothbrush is bristle to prevent bleeding. You have alert bracelet. It's going to let us know that you're taking medication. Cilium is going to make your stool softer, right? It's a bulky agent, prevent bleeding. Motrin, you're going to bleed. Prednisone is going to cause ulceration, GI ulceration, and you're more likely to bleed. Contact sports, you're going to bleed. I don't want you to do that. And you should not stop taking, or you should not use oral contraception because this is teratogenic. It's not teratogenic like warfarin. So you see, these are all little things you have to teach the patient so that they will be aware of, because they don't know that dabigatran doesn't do all of this. It may be consistent with warfarin, but it's not that. Those are your right answer. And those are the explanation that dabigatran is a factor 10. It does not require monitoring, no lab, no diet, all of the information I've listed. And those are the ones we saw in the answer. Number 15, what do you think? Pharmacology in a fancy way. Line number. A nurse is caring for a client with CHF. What are the medications to use for CHF? Client is receiving lisinopril, ethacrenic acid, digoxin, isosorbide, mononitrate. What is the expected action? You have to know what these medications are for. Lisinopril, ethacrenic acid, digoxin, isosorbide. What do you think? Let me know. Put down your answer in the comment section. Arrange them the way you want. And then let me know what you think. But which of this is appropriate? Match them. If you have heart failure and you take lisinopril, it's used for remodeling. Ethacrenic acid is a loop diuretic. Therefore, what do you think? It's going to remove fluid from you. If you remove fluid from you, it's going to improve your oxygen saturation. Digoxin is involved in contractility. Therefore, that. And the isosorbide is a nitrate. It decreases venous return. These are the functions of these medications regarding heart failure. Know them, know them, know them, and take a look at this picture and learn about them, because these are pharmacology that will show up. Commonly tested NCLEX practice question, NCLEX review question, NCLEX questions and answers to help you pass your NCLEX. What do you think? Now, we have a bowtie question, right? What is the problem? This is the question. Now, we have a bowtie question. A 3-month history of what? Progressive dyspnea on exertion. Oh, report of what? Recent productive what? Blood thin sputum. That's a buzzword. Anybody who have blood thin sputum is a clue. He has been using more pillows. Whoa, he's using more pillows of late due to shortness of breath in supine position. What is going on with this patient? Wakes up in the middle of night, right? That's autopnea. He has no chest pain. His heart racing or dizziness. He has a history of hypertension and sleep apnea, but he denied tobacco and alcohol. Did you figure out what is wrong with the patient? Look at it. 3-month-old, history of what? Progressive dyspnea on exertion. As he moves, he has what? Dyspnea. A report of what? Blood thin sputum is a buzzword for a certain condition. He's using more pillows. He can't lay flat. He's waking up of night, what? Autopnea. His vitals are fine except the blood pressure is high. His oriented times 3 is pleasant. He has crackles on the lung basis. His abdomen is distended. You can feel his liver. So his liver is big. Warm feet with +3 edema. Stop the video. Put it down in the comment section. Normal 16. Tell me what you think after reading this. You know what it is. Practice this way. After you read it, you should be able to come up with the diagnosis. This is patient look like he's having CHF. And therefore, what do you want to do? Select 2 actions to take. What do you think? What do you want to do? Select 2 actions based on this patient, the condition this patient is in CHF. Therefore, what are we going to take? Restrict that. And we're going to give them diuretic. Restrict what? Sodium, give them diuretic. And then after that, we can make our diagnosis. What do we think? It's not cirrhosis. Cirrhosis is not going to give you all the heart failure symptoms. You may have ascites, but no. Sleep apnea does not present with that. There's no fever. It cannot be pneumonia. Therefore, we know heart failure. And therefore, what are we going to monitor? If I give you diuretic, I'm going to monitor your BMP. And I'm going to check your daily weight. I don't need to worry about you vomiting or your CO2 saturation because those are all sleep apnea patients. And therefore, this patient, daily weight and that. This is the way you do bowtie. Straightforward, but the case give you everything. You should be comfortable trying to know what is going on, and then you can figure out what is going on. It's better that way to master bowtie like that. And that's the question we solve. And next is what? Is caring for a client with hearing loss. Patient has hearing loss. The charge nurse observed the caring nurse provide routine care. Which of the following action by the nurse require intervention by the charge nurse? Patient hearing loss. That means he can't hear properly. And then the charge nurse is observing the regular nurse seeing this patient. What is going on? Nurse speaks in loud voice. Why do you want to speak in loud voice? Do you think they want to hear? They can hear you, but why do you want to speak? Speaking in loud voice, you think you provide the opportunity to relay your information? Maybe that's what you think. Should the nurse intervene, charge nurse intervene with that? Nurse directly face the client when speaking. When you're speaking, you're facing them. Nurse turn off the television set when speaking. Usually they will use your mouth. When they can't hear, they can use your mouth. Next, ensure hearing aids are functioning. You give it an hearing aid and they can use it. Next, uses facial expression and hand gesture. And like I said, if they can't hear you, develop more senses. That is your vision. Next, start talking right away after entering the room. Well, I don't think the patient can hear you. That's not good, right? Therefore, what do you want to do? Which of these should we intervene? Well, you shouldn't be speaking in loud voice. The nurse turn off the television when speaking so that the patient can pay attention. Nurse ensure that the hearing aid is on. That's good. The nurse turn directly and face the client before speaking. That's good. If you start what? Talking right away after you enter, the patient has no clue. You use gestures to be able to what? Express your feeling is good. Therefore, 2 things we should intervene is speaking loudly and talking right away. Otherwise, the patient will be started up. Write this. I want you to know that that's how you talk to patient who has what? Hearing problem. But their vision will be developed. And this is caring for a client who present to the emergency room with 4 days of large volume, non-bloody emesis and nausea. Which of the following you should expect? This is a straightforward question. If you know NG tube, this question is easy. Patient is vomiting. When you vomiting, you vomit your sodium 1. Sodium is not going to go up. You vomiting what? Your acid, you don't develop what? Metabolic acidosis. You're going to lose your potassium. You don't have hyperkalemia, you're going to get dehydrated, your hematocrit will go up. You're going to get dehydrated, your BUN get up. Therefore, which one should you expect? It's a lab value. NCLEX lab value. I want you to master them. Those are lab values. And therefore, this patient and that patient is what we need. 19. And NCLEX needs several rooms in intensive care unit for a client, incoming client with severe injury after motor vehicle collision. Somebody have multi-trauma, which client is not appropriate for transfer out of the ICU. That means this patient is unstable. That's all. Figure out who is unstable. Stop the video, number 19, and let me know who is unstable that we should wait. A client admitted for chest pain now with what? 3 sets of normal troponin and EKG. Normal. Client admitted with stroke 7 days ago and is what? Has leg weakness. A client admitted with what? Acute asthma exacerbation 5 days ago. His peak flow is 89. A client admitted with what? DKA, now pH is 7.2. Urine is positive for ketones and is lethargic. Prioritization and triage nursing. This question is a triage nursing. Stop the video and let me know what you think. I would like to know what your answer is for number 19. But I can tell you, if you have chest pain and your EKG is normal, times 3, we're good. And your troponin is normal, we okay. If you have what? Stroke 7 days ago and you have leg weakness, that's residual what? Damage already done. We can't reverse it. There's no new damage. If you have asthma and your peak flow is 89, you're on the green zone. You're good. By default, DKA patient is in trouble. And that's the one you have to see. Now, oxygen devices. I know you know them. If they show you a picture, can you figure it out? And then she's teaching new graduate about the use of what? Oxygen device. Which device is the most appropriate for a client with a COPD with exacerbation? I told you these are most commonly tested questions based on recommendation. I powered them up. I created these questions so that you can use it. Which oxygen device is good for COPD? You need precise amount of oxygen. And what is that? Ventral mass. Which of this is a ventral mass? Is this guy? Is this with the chin? Is this without a chin with the cap? And with these 2 prongs? This is nasal cannula. It's not useful. This is a simple face mask. This is a non-rebreather. You need a precise one. Ventral mass is what you need. And that's the right answer. And this is what they look like. He has this green chin. There's no bag associated with that. It's straight. Know it. Ventral mass, non-rebreather, face mask, simple one, and nasal cannula. And next care for several clients. Which client situation require immediate intervention? Prioritization. Once again, adapt NCLEX way. Immediate intervention. You have reflux. Complaining of constipation, I give you what? Sucralfate, expected finding. You have IBS. You complain of what? Dryness. After I give you what? Dicyclomine, expected finding. You have schizophrenia. You complain of drooling. After I give you olanzapine, expected finding. It's due to salivation. Don't pick it because you see drooling. I don't want you to pick it. You have stroke. You complain of headache after I give you tenecteplase. That is Atoplex derivative. You are bleeding in your head. You have hemorrhagic stroke. I will pick you. This is the way you do prioritization. You see, you got to talk through and talk it as if it's normal, and then you master it. And let's provide care for a client in emergency room, motor vehicle collision, triage question. Vitals, temperature is fine. Heart rate, oh, bradycardia. Blood pressure is high, hypertensive. Do you see it? Respiratory rate, irregular. Saturation is 95. What is your priority? These are buzzwords. This is like a mini case study. I give you the buzzword. I want you to master them. Bradycardia, check. Hypertensive, check. Irregular respiratory rate, change stroke. This is what we call Cushing triad. That means you have an ICP issue. What is your number one thing you do when somebody is having ICP? I break it down. This is the way I want you to break it down. EKG is not going to help you. The irregular heart rate is nothing. It has nothing to do with your heart. It's because you're herniating. I'd rather say, will you managing the blood pressure? I don't want you to manage it. Give them a fluid. It's not going to help. Blood pressure is too high. Elevate the leg, head. That's the least you can do. Blow the CO2 out. Give them medication like mannitol 3% to decrease the ICP. And that's the hyperventilate them. Give them hypertonic. Keep the head in a neutral. Elevate the head. Know this. You see, these are concepts. All the questions, like I said, it's a concept. Exactly like this one. A classic NCLEX concept. I want you to know it. And then she's caring for a client on mechanical ventilator. I have a good video on mechanical ventilator in terms of what you need to do, alarms, and that's one of these questions. A ventilator trigger what? Low pressure alarm. Which of the following should the nurse consider as the possible cause? When you see high, low pressure alarm, think about it. The ventilator is a closed system. This is the ventilator. This is the patient. They connected each other. If there's a leak, air leak out, you have low pressure. If there's a blockage, there is no air going increase. Therefore, look at them. Anything that looks like a blockage is going to give you high pressure. If you look at it like a leak, you're going to give you a low pressure. Pneumothorax is a blockage, negative. Self-extubation, oh, leak, there's no connection between the patient and the tube. Kink, high pressure. Biting tongue, the tube, high pressure. Mucus plug, high pressure. And F, there's the leak. Therefore, you know the answer. Extubation and the leak are what is going to create low pressure alarm. 24. And then she's assessing a client 34 weeks gestation about successful induction with pitocin, which finding the nurse should document as a successful indicator. This is a hard question. It's called Bishop score. There's a classic things about Bishop score that you have to know. It's a whole video. I don't want you to watch a whole video. I will give you 5 few things you should worry about. That's what made up each get at least 2 points. If your cervix is anterior, it's good. If you are in the station that is positive, is better. So we want a positive station, not a negative station. We want the cervix to be way dilated. That's good. And we want effacement to be very high. And then we want something that is consistent. You see? So those are good parameters that will help, right? As much as possible. These are very, very good. And that will indicate what? Induction. Negative station is not good, but anterior station is good. Cervix is dilated. Effacement is okay, but this 50% is too low. We want something like 80% at least, right? And the cervix is consistent. And so these are something we pay attention to. And therefore, the right answer is we're going to pick anterior cervix. We're going to leave the negative station. We want what? Cervical dilation, and we want consistent cervix. Effacement, 50% is halfway. It's not the best. We want something close to like 80%, as much as possible. And this is reviewing prescribed medication for a client with what? Bipolar disorder who is taking lithium, which prescription the nurse should clarify with the ordering provider. That means if you're taking what? Lithium and you are bipolar, you should not take certain medication. We saw a similar one I'm trying to do it like the NCLEX style. You see the same thing so that you can say, okay, did I make any mistake? Figure out. Lithium, you should not take Motrin, right? You should not take ACE inhibitor. It affects your kidney. You should not take what? Diuretic. It affects your kidney, causes dehydration. Acetaminophen is good. Risperidone is what? Antipsychotic. You can take it. So know this. These are the things you should avoid for lithium. Now, a nurse is teaching a client with what? Left ankle fracture and a new crutches, which statements made by the client need immediate follow-up. Select the plan. Crutches, 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 how do you walk? And when I see these fundamentals of caution and safety, I go with the keyword, left fracture. That means one leg is good. So the left side is the what? The one is in trouble, affected leg. Therefore, when you answer a question, need immediate intervention, focus on the affected leg. I will move the crutches and affected leg simultaneously. Oh, that's what you're supposed to do. Don't worry about it. I will keep the crutches 15 centimeters apart in front of and on the side. Yeah, on the side, that's where you put the crutches and 15 centimeters apart. That is good. I will always assume 3-point stand. Yes, the affected leg is up and the crutches and your good leg will form 3-point stand. When going up the stairs, what do you go with? That's the key. Know this. When you're going up the stairs, you go with the good leg. I will move the affected leg and the crutches first. Negative. You're going to fall. I will keep the elbow 25, 30 degrees, right? And bear weight on what? On your armpit. Hey, you should not do that. You know that, right? Bear weight on your armpit. You should bear weight in your hand. That's not good. Even though the, what did they call it? The elbow burning is fine, bear weight on the armpit is a problem. You shouldn't do that. And I know you know that. That's a trap. I will ensure 1 finger breadth between my armpit and the top of the crutches, at least 2 to 3 finger breadth. Therefore, this also wishing to pay. The questions say, need immediate intervention. The elbow is 20 to 25, 25 to 30 degrees, but you shouldn't bear weight on the armpit. You should bear weight in your hand. Know this crutches stuff. And then she's providing teaching to a new graduate about blood transfusion. This is a concept. I want you to stop the video and then write it down. If you don't know it, if you know it, good. But if you don't know it, I want you to write it down. Which statement correctly describes AB or transfusion protocol? There's a protocol why I can give you blood and another person cannot give you. And why AB is what? A universal recipient, and O is a donor, universal donor. This is the way it works. The antibodies of the recipient, if this is me, there should be, my antibody should not react with the antigen of the donor. That is the all. That is the key. Antigen of the recipient, no, it's the antibody. It's very confusing. So I don't want to keep on repeating. I want to show you the right way so that it doesn't play trick with your brain. It's the antibody of the recipient. So if you see anything else, don't pick it. Antibody of the donor. No, I say antibody of the recipient react with the antigen of the donor. Antigen of the donor. No, it's not going to react with the antibodies. It's the antibodies of the recipient reacting with the antigen of the donor. And that is the key concept. If you keep on changing it, you got it wrong. Always say antibody of the recipient react with the antigen of the donor. This is why AB is a universal recipient, because he has no antibody to react with the donor, right? That's why antibody of the recipient, the AB is a universal recipient. He has no antibodies to react with you. And then O is the donor because he has no antigen for you to react to. That is the key. Okay. 29. And then provide care for a client with what? pH of 7.26, that's acidosis. Serum 5. Potassium 5.1, that's a high. Glucose is 240, that sounds like DKA. Which action is appropriate? How do you manage DKA? IV fluid, IV fluid, IV fluid, IV fluid. Give them insulin, negative. Prescribe IV saline, excellent. Give them D5W infusion, negative. Requires prescription for sodium polyestyrene, is going to lower what? Your potassium, but that's not the treatment. Number one is fluid. Question 30. How are you doing so far? We are halfway. How are you doing so far? Let me know your score in the comment. If you're tired, I can always say, stop the video, go rest, wake up, and come back and continue with this. Because this is most commonly tested. You see the concept we're talking about? I yield fact for NCLEX questions, and you have to know them to be comfortable. Let's go. And let's provide teaching to a client with what? Emphysema. What is it? COPD. There's a concept. What the most important practice of cough is not bronchitis. I said emphysema. Practice lip pursing, breathing is good. It prevents air trapping. Eat large meal a day. Small meal is better for COPD patient. Exercise for 4 hours straight. You're going to get tired. Therefore, what do we do? First sleeping. 31. Infectious control. Like I said, random question. You got to bring your brain. And then she's preparing admission to a client diagnosed with what? Varicella with open lesion. Varicella with open lesion, which next intervention is appropriate. Varicella is what? Airborne. If you have open lesion, you have contact. And therefore, what you want to do? Client in what? Negative pressure room, excellent, right? Client wears surgical mask, he does not wear anything. Client wear N95 when you're going to the radiology to do anything, no. And what else? Next, wear gown, gloves, N95, that's airborne and contact, it's okay. Client door is open, should be closed. Sterile disposable gown for visitors. Well, what do you think? It's not enough. Why would you give them sterile? It's not supposed to be sterile. It's a trap. Therefore, this is what the next way. And then provide care for a client with what? End-stage liver disease. Which finding is consistent with this disease process? What do you think? Let's look at our liver and figure out what is going on. Is the bilirubin going to be elevated? Is the platelets going to be elevated? Is your PT going to be elevated? Is your albumin going to be elevated? And then albumin going to be elevated. Think about it. The liver is responsible for clearing bilirubin. Therefore, if your liver is affected, what do you think? Your bilirubin is going to go up. Therefore, that's what you expect. Classic question, right? Platelet is going to be chewed by the spleen because your spleen gets bigger. It goes down. For thrombin time, that's create a INR group, right? This is a PT. Your PT, what does it do? When you have liver function, it goes up. Ammonium, you cannot clear ammonia, it goes up, it doesn't go down. And your albumin, you cannot make protein, it goes down. And so those are expected lab finding you should expect in the liver patient. So A and C are the right one. All the rest is negative. You can stop the video and let me know what you think. You can put it in the comment. And let's provide curve for several clients. Which client the nurse should see first? Prioritization 101. Same strategy. Divide them into two. Figure out whose conditions is a problem. And then pick everything that you know as a B-sharp moment. continuous bladder irrigation. He has suprapubic spasm. Should you worry about it? Stable angina with headache after taking nitroglyceride is the expected finding. I have latent tuberculosis. I report sudden onset of what? Orange urine after starting rifampin derivative. Should I worry about it? I have tea-colored urine for strep infection. Now I have headache. What do you think? This is classic prioritization. Break it down. Well, suprapubic pain is expected when you have bladder irrigation. Nitroglyceride, you're going to get headache. Rifampin derivative give you orange urine. Therefore, by default, this is your right answer. What is the problem? If you have strep, post-strep infection, you're going to have edema. But when you develop headache, that's prioritization. You have ICP issue. We should worry about it. Your blood pressure is too high. It's causing hypertensive urgency, and we have to do something about it. Number 34. This is OB prioritization. A nurse is reviewing phone call from client of labor and delivery emergency phone line, which client need first phone call. You have 37-week-old with the lower abdominal pain radiating towards the groin and is relieved by walking. What do you think? 37-week gestation with contraction that lessen after resting. After you rest, it goes away. A 37-week gestation with lower back pain that radiates to the lower abdomen every 5 minutes is regular. 37 weeks gestation with increased mucoid discharge that is brownish in color. What do you think? 37 weeks lower back pain that and abdomen that increases despite walking and resting. Who are you going to see? This is asking you about through labor. Which of these is through labor? Frequency of contraction, changing in the cervix, changes in the effacement, location of the pain is classic. If the pain goes away, it's not through labor. If it lessens, it's not through labor either. If you radiate and is regular, it's good. Number 3 is right answer. Mucoid discharge is not associated with labor. It can happen without labor. And if the pain is getting worse, whether you walk or not, it's a true labor. Know this. Maternity question. Maternity nursing prioritization. Same thing. And it's caring for a 38 weeks gestation who's receiving pitocin for induction. What did you see? You saw this. What do you think? How do you read this problem? Look at the bottom. That's the mother contraction. You need just 5 contractions in 10 minutes. Then look at what the baby is doing and see if mommy contract, something is happening to the baby. Look at it. Mommy contract, nothing happening. At the peak, nothing. And then baby goes down. Mommy contract until at the peak, baby go down. That means this is a late, what? Deceleration. Baby does not decelerate right away. It does decelerating after we've reached the peak or after we've contract. This is what we call late deceleration. Therefore, if this is late deceleration, what do you want to do? Write your line and then take care of your VCHOP, right? VCHOP mark. Therefore, if it's late deceleration, it's placenta insufficiency. If placenta insufficiency, well, I have to do my line. And what is that? Position. If you're taking pitocin, I stop it first. That's the first thing I would do. You got to stop the pitocin. And after you stop the pitocin, you got to place them in the left lateral because it's placenta insufficiency, not need to chest. Don't pick it. And then we give you some fluid. We're going to give you oxygen, but not using nasal cannula. We have to use non-rebreather. Watch for that. That's a trap. Or face mask. Non-rebreather is the best one. And then we let the doctor know. So which steps are you going to take? That's what they ask you. Which of the following action you should take? Stop the pitocin, infusion, and notify the doctor. Lateral position and face mask. Not that one. If you need help with fetal heart monitoring, check Adapt NCLEX. Bunch of video for you to help you. And this is monitoring a 37-week in labor. Assessment reveal what? 8 centimeter dilated. That means what? You have to know that. 100% in phase. That means I'm almost finished with what? Stage 1, right? I'm on the 3rd stage trying to finish contraction 1 to 2, what? Minutes apart and urge to have a bowel movement. Remember phase, stage 1 is divided into 3 phases. This patient is in what? The 3rd phase. I always say when they give you dilation, look for it. Divide it into 3. This is 1 to 3 centimeters. This is 4 to 7. And this is 8 to 10, which is consistent with the effacement. Therefore, I'm in the transition zone. You have urge to have a bowel movement, urge to do something. What do you teach the patient? Don't push. Placenta delivery doesn't occur at this stage. We've not even finished stage 1. Epidural is too late. Teach the client not to push. Excellent. Bishop score, we do that after the latent stage, right? Usually at the active stage. We're too late. We can't calculate anymore. So this one we got to teach them. And then this is monitoring a client in active labor. The client report abrupt onset of what? Severe abdominal pain and vaginal bleeding. Bars with abrupt onset, severe abdominal pain and vaginal bleeding. Assessment reveal loss of what? Fetal station. That's the key word. Cessation of contraction, fetal bradycardia, and maternal hypotension. Which condition do you think is suspecting? Know these bars with placenta previa, abruption, uterine rupture, involution. What do you think? Previa, what? I would say cervical ulcer, painless vaginal bleeding. That's gone. Abruption, I would say, yeah, painful, but there's dark vaginal bleeding. I won't mention loss of fetal station. Involution, what do you think? Placenta delivery at that time. We've not even delivered the placenta. Uterine rupture. Concept, to answer this question, you can see these are all straightforward questions if you know the concept. Same thing, maternity. The nurse is monitoring a client 37-week gestation who is in labor and receiving oxygen, which finding on the fetal monitor is concerning. I want you to know this maternal fetal heart strip concepts. Do you need 5 contractions in 10 minutes? Is your duration less than 90 minutes for each contraction? The distance between each contraction, you need at least two minutes. So your resting tone should be 30 and your strength of contraction 90. Know these 5 numbers, a classic fetal heart monitoring. Yes, 5 contraction in less than 10 minutes is good. The duration of each contraction should not be more than 90, so less is good. Interval, at least 2 minutes is good. Your resting tone should be 20. It shouldn't go past 20. And your strength of contraction should be 80. Therefore, these 2 is that. Repeat this video section, write them down so that next time when you see them, you know what. And those are the numbers. Take a picture of it and match to them. And let's prepare care for a client with Crohn's disease, immunocompromised. You see, I'm giving you the way to read the question. When you read it, you say, oh, something is happening. Adalimumab, immunocompromised, has been ordered. Which next action is very important? If you're taking immunocompromised medication, you're going to do what? Do we need PPD test? Do we need to check your blood count? You need to check the X-ray or dose of the medication. I don't care about the dose of medication. Neither is X-ray. What I worry about, infection, activation, that is TB. If you take this medication, it suppresses your immune system. And therefore, if you have PPD exposure before, it's going to activate it, reactivation. Therefore, we need to place PPD so that we make sure you never had PPD. And if you do, we're going to stop the medication. Number 40. Few more questions left. How are you doing? I'm checking on you, making sure you're getting the concept. And you're writing every time. You're stopping the video, you're attempting to answer them. That's the way to benefit from this. And then she's providing teaching to a client, prescribe what? Levothyroxine for hypothyroidism. What do you teach them? Pharmacology, endocrine pharmacology. That's what we're doing now. Take the medication on an empty stomach. Take medication in the morning. Remain upright for 30 minutes after taking the medication. Add omeprazole to the pill to ensure fast absorption. Take the medication with full glass of water. What teaching do you provide? You're taking levothyroxine. I did an endocrine video recently. You should watch it. It give you all the concept, including this medication. But I can tell you, empty stomach. Empty stomach is consistent with early in the morning because it's esophagitis. Remain upright. You should avoid antacid. Therefore, avoid it. Take it with the full glass of water, consistent with empty stomach. You see, they're all in sync, saying the same thing. I know you mastered them. And let's provide care for a client who sustained massive myocardial infarct after being admitted for pneumonia. Which of the following action by the nurse is appropriate regarding postmortem care? This is very classic. End of life postmortem care. Patient die. What are the things you do to provide a good postmortem care? These, I want you to write it down. The number one is we have to avoid certain conditions that will cause discoloration of the face. We want to prevent that. We want to prevent contraction, and we provide some dignity. Remove all dentures. Don't touch it. Let the face remain. Therefore, we're not going to do that. That's classic. Number one, traffic question. Place pad under the perineum. Things are going to leak. That's good. Remove all tubes. Patient suddenly died. It was not intentional. Therefore, leave it for autopsy. Close the client's eyes. Yeah, gently. Pillow under the head. Yes, to support the head. And don't put them on the supine. Otherwise, blood will pool in the whole face and then causes what? Discoloration. You want to raise them up semi-fowler and allow blood to descend from their head. Therefore, those are your right answer. Know this postmortem care, take a picture of it, and master them. Another question that we see will trap you, but don't worry. Pharmacology, this is the way to test your knowledge on pharmacology. Is adapting NCLEX Q-Bank way of structuring pharmacology. The next is provided teaching to a client who is prescribed what? Levothyroxine, phenotime, etobital, and digoxin. Match the medication to the appropriate priority teaching. What do you teach them? If you take digoxin, what do you tell them? If you take levothyroxine, what do you take them? If you take phenotime, what do you tell them? And etobital, what do you take them? Think about it. If you take digoxin, which of these should you tell them? Frequent high exams, call with anorexia, remain upright 30 minutes, or have a protein. GI symptoms, number one. So that's what we call. Levothyroxine, remain upright, esophagitis. Phenotime, avoid protein. And etobital, you need a high exams. You see, this is what the NCLEX is going to ask you. Once again, most commonly tested questions based on previous exams. These are what shows up. This is what was told. And I've created a question related to that topic. This is the way they will present it. I don't know any other way, but I want you to take a note of all the medication, all the content. If you know them, you go there. These are something that may show up in your test. And then preparing a new graduate today, what? Cardiac unit. In discussing the difference between what? Heart and what? Right and left heart failure, the graduates will select what? Once again, in discussing the difference between right heart failure, the new graduate will select what? What is he going to select? Which one is the right heart failure? Low urine output, hypotension, lung crackles, and edema. What I teach people is when you deal with right and left lung heart failure, right side is systemic congestion. and the left side is the lung problem. Therefore, if you see lung problem and hypotension and urine output, leave it. That's for the left. Therefore, I see urine output, hypotension, lung, leg edema. I'm taking it. Atopnia is a lung problem. Ascites is systemic. Pink photospirium, lung problem. Shortness of breath, lung problem. I'm picking ascites. JVD, systemic, wheezing, lung, cough, lung, rails, lung, JVD. This is what is typical of right-sided heart failure. 45. This is a hard one. It's okay. You got to get hard ones. And next, provide care for a client with new finding in the telemetry unit. Order the steps the nurse should take based on the finding. If you don't know this, it's okay. I want you to write it down. What is this? Classic SVT. Why? I see a uniform RR interval. I don't see a P wave. It's buried in the T wave. That's SVT. This cannot be AFib or aflutter or sinus. So SVT. The treatment is adenosine. But how do you treat them? That's the key. How do you treat this? Based on the condition. You have to be familiar on how to take care of these patients, especially if they give you a question. Adenosine. It's an SVT. The first thing is you got to put them on a cardiac monitor, number one. They need an IV. That's the way you're going to give it to them. And then we got to administer adenosine very short and fast, 1 to 2 seconds. And then you got to flush it as much as possible. Then you got to monitor chest pain because their heart is going to stop. And then you may repeat the dose. Write these down. This is the steps associated with SVT and the management of it. It's very, very important, and it's good to know. Classic NCLEX question. And then provide teaching at discharge to clients with what new diagnosis of reflux. Well, they love this, reflux and damping syndrome. Which statement made by the client indicate need for further teaching? I said select 2. Try to help you. I'll give you a bunch of them. But there's 2 which are wrong. I will eat more frequent meal. That's good. I will avoid dairy products. No, the products you should avoid is called CAT, right? Caffeine, alcohol, tobacco, and smoking. This needs further teaching. I will eat at least 2 to 3 hours before meal. Do you want to do that? 2 to 3 hours is enough, right? I will avoid chocolate product, of course, like the CAT I told you. I will elevate the head of my bed to 2 inches. It's too low. 6 inches. 2 is too low. We need 6. I will need to decrease the spicy flavor in my diet. Avoid what we call, I told you, CAT, right? Alcohol, tobacco, and spicy food, and smoking. And then I will need to decrease what? I will engage in moderate exercise 3 times a day. Yes, we want to lose weight. So those are conditions you have to teach the patient, and those that we need further teaching. You don't need dairy product. And then what is the problem? Head of the bed, 6 inches. 45. And nurse is preparing to admit the client with diagnosis of C. diff, which infections control is appropriate. Infectious control, C. diff, it's a contact precaution. If this is a contact, what do you want to do? Single-use equipment, disposable single-use gown, face shield, nurse wear N95 masks with routine care, nurse wear gowns, sterile gloves, face shield during routine care, door closed at all time. I'd like to know your answers. What do you think? Contact means door is not the problem. Single-use equipment, sound right. Disposable gown, sound right. Face shield is not used for routine care unless you check your wound and there's a splash. You don't need N95. Once again, no sterile gloves. The gown gloves is fine, and the face shield is not good for routine care, but the sterile gloves is wrong. You need what? Regular gloves. And the door does not need to be closed at all time. I said select 2, but if I did not say select 2, You have to pick those that you are 100% confident. So be careful. Number 47, and let's provide care for a client prescribed what? Captopril for essential hypertension. Which statement made by the client at discharge indicate need for further teaching? Pharmacology. This is a pharmacology question. It's about what? Captopril. Break down the question and say, what is the question asking me? Further teaching on the captopril at discharge. Therefore, if they're saying something that is not consistent with captopril, then you pick it. So let's analyze each one of them. I will check my apical pulse. Well, it's not digoxin. Therefore, I'm not worried about it. I'm going to pick you. You don't know what you're talking about. I will have what? Potassium-rich diet, because what? Lisinopril increase your potassium. That's good. I will continue to monitor blood pressure. You having taking blood pressure medication? Monitor it. I will need to have bedside commode at night due to expected frequent trip to the bathroom. You're not going to pee. I need to intervene. It's not diuretic. I will notify my healthcare provider if I become pregnant. This is what? Teratogenic. Therefore, you can see those two information that you need to use. Bedside commode, and you don't need to check your pulse. Number 48. And let's provide care for a client diagnosed with what? Crohn's disease, which finding the nurse should expect hypokalemia, hyponatremia, hypotension, headache, and what? Metabolic alkalosis. This question is all endocrine, and I know you got it. Therefore, what do you think? Think about it. Crohn's disease is what? Aldosterone. If this is aldosterone, it's going to increase your sodium, your potassium goes low, and your blood pressure goes up. Therefore, what do I expect? Potassium is low, is good. Sodium is going to be high. I don't expect that. Hypotension, if your sodium is high, blood pressure is going to go high. You're going to get headache because your blood pressure is too high. You see how it makes sense? Classic. And then what happened? Metabolic alkalosis. Think about it. If you have Crohn's disease, you put potassium inside the cell, so you lose potassium. Your body will try to bring potassium back, and when it brings potassium back, it pushes acid inside. In the process, you lose an acid. Therefore, hypokalemia causes metabolic alkalosis. Therefore, we got to also pick that. This is consistent, that is consistent, and that is consistent. And as I said, a client after starting a citalopram 7 days ago, which statement made by the clients concerning? First, stop the video. Let me know about this. Therapeutic communication, at the same time, pharmacology. This citalopram is in the lopram group. What does that mean? This is what? SSRI. SSRI, if I start and you come back in a few days, within 2 weeks, suicide is my problem. Therefore, which of this is a suicide? I have gained 2 pounds in a week. You're going to gain pound. I don't care. I donate my new car to a charity. Oh, you're giving up. My sex drive is low. Your libido is going to go down. Expected. I will feel the same as before. I feel the same as before because it takes 3 weeks to work. Therefore, this is good. This is good. This is good. But this is bad. Suicide ideation. 50. How are you doing? Where you are? A few more questions. Stay strong. Let me know. I'm cheering on you. I'm your cheerleader. I want you to finish it right now, the concept. Let me know. But I will be your best cheerleader. And next is precepting a new graduate to care for a client with what? Malnutrition receiving NGT feeding. The healthcare provider prescribed the following medication. Which medication the preceptor should ask the new graduate to clarify with the other provider? What do you think? Sometimes you see these long questions, you say, what are they talking about? Let's break it down, adapt and class way. Select or apply. Which medication the preceptor should ask the new graduate to clarify? Okay, and nurse is precepting a new graduate to care for a client with what? More nutrition is irrelevant. But what is the problem? It's getting fed through the NG tube. The air care provider prescribed which of the following? Oh, nifedipine tablet extended release, sulfur drug double strength, aspirin, enterocoated, Adderall sustained release, isosorbide capsule, sulfur drug single strength. You know the key. No capsule, we don't crash it. Extended release, we don't crash it. Sustained release, we don't crash it. So anybody that have that name, you picking it, even if you don't know that medication. Extended release, I'm picking you. Single strength and double strength, they are traps. You don't need them. Enterocoated, we're picking you. Sustained release, we're picking you. And a capsule, we're picking you. All of them, you cannot break them down. And let's provide care for a client with what? Chronic kidney disease. At 7 o'clock, you have what? Hemoglobin index. This is consistent with chronic kidney disease, a little bit of anemia. Potassium is high, sodium is normal. BU and creatinine expected, right? Potassium, I don't like it. It's almost close to 6. This is the orders. We need to type and cross and screen and give them blood. We need to give them hypotension, put them on a cardiac monitor and dialysis. Which one would you do first? Get a blood, do what? Hypotension, cardiac monitor, and dialysis. Think about it. Well, I expect the hematocrit not to be normal. I have time. Potassium is too high. I got to see if there's any cardiac changes. Hypotension is associated with what? The hemoglobin. It's not that low. Dialysis is irrelevant right now. Most important is cardiac monitoring. We will go to dialysis, but I need to monitor your cardiac function, make sure the high potassium is not affecting you. That's the right answer. This question is a bonus question, but it may be tricky if you don't know what it is. Question 52. A nurse is orienting new graduate to a med-surg unit. Which of the following the nurse should include when discussing SBAR, right? The S, what does that mean? The B and A and R is medicine, nursing care. You know better. You know what it is. I'm not going to trap you. You know what it is. It's a situation, right? It's not service or survival. Therefore, A and B is the right answer. Now, I'm on A and B. Which one do you pick? Background. Both have background. But it's assessment, not assignment, and a recommendation. So that's our SBAR. Next generation question. How are you doing? Client report what? Worsening shortness of breath, fatigue, dry cough at night, and tight chest pain for the past 2 days. Does that give you a clue? I'm trying to let you think this is the way NCLEX, they don't give you a scenario, say this is what the client is complaining. He's a non-smoker. He doesn't smoke. And he has seasonal allergy, no recent sick contact. But he has what? Shortness of breath, fatigue, dry cough at night, and chest tightness. Is this what? Pneumonia or something? I don't know. Ongoing audible and expiratory wheezing. I hear expiratory wheezing and worry about what? One thing. Throughout lung fields, bilateral, he used accessory muscle. That's the key. He's having respiratory issue. And he's complete, he cannot, and able to complete full sentences. So he can talk. He's in a tripod position. He does not like it. He's trying to breathe. He has taken albuterol, ipatropine, and IV solomedrol. Therefore, they treat him for acute situation. Now, the extreme limit at 1400. After all this, he's extremely, he's breathing really fast. He's confused. He's wheezy. He's tachycardic and all this. His saturation is 89 on 6 liters. It's not responding. What do you think is going on? You think this is an asthma? Do you think bronchitis, allergic reaction, or what? Anaphylactic? There was nothing in the case that tells you patient had any allergy to anything. Neither was he taking anything. Bronchiolitis is very young. They will tell you runny nose, everything looks so bad. They're congested. And therefore, this case, patient is suffering from what? Asthma. If he's suffering from asthma, what is the question? Select two action to take. What action are you going to take? He's already on IV medication, steroid. You're getting albuterol, ipatropine. What is the next thing you should do? Epinephrine and magnesium, because then that will overcome if there's any allergy responsible. Accepted system will create mucus. You worsen the condition. You don't need a caution. And we already know these patients. And therefore, what parameters are we going to monitor? Well, if I'm trying to improve your oxygen saturation, I want to make sure your respiratory rate is going down and your saturation. I don't care about your temperature or your blood pressure. And that's the condition. But this is an asthma exacerbation. And based on that, we have to do what? Give the patient certain conditions, right? Epi, magnesium, and then we have to monitor oxygen and respiratory rate. So those are your answer choice. Now, I told you this test is really hard. It's very hard because I want to create a situation, a scenario for regular NCLEX. So I want you to watch this multiple times and know all the clues that are laid down. What do you think? Highlighted information. I have CHF, essential hypertension, hyperlipidemia. He was discharged on with what? Bumetanide, atenolol, aspirin, and digoxin based on their medical condition. Client is now reporting complaint of what? He's been compliant with his medication, so he's been taking it. He feels tired all the time. The room is spinning. He's hypotensive when he get up. His blood pressure is high, a little bit normal, and heart rate is fine. Physical exams look normal, right? And therefore, what do you think is going on? He has CHF. He has had exacerbation for 7 days, and he's back into the hospital, and we feel tired all the time. What is going on with the patient? The question is, which of the boarded finding is concerning? Which one should you worry about? Because he has CHF and he has exacerbation for 7 days, because he has hypertension, hyperlipidemia, because he complained that he's been using his medication. If you're tired all the time, the room is spinning, all these things, you got to put it in the perspective. What do you think is going on with this patient? Exacerbation for 7 days is not good. I feel tired all the time is not good. Right? Room is spinning is not good. He has hypertension, hyperlipidemia, and CHF. And so what? What are you going to do about it? Right? He reports that he's been compliant with his medication. He's doing great. His blood pressure is fine. So those are the conditions we should pick. Now, the next, understand that the client may be experiencing orthostatic due to what? What is causing the orthostatic? He take what? Diuretic, atenolol, aspirin, and digoxin. Which of this you think is the number one to cause what? Orthostatic hypotension. Which one? What do you think? Which one is the number one to cause orthostatic hypotension? No aspirin. Atenolol may do that, but it's not the most common. Orthostatic mostly, that atenolol will cause bradycardia. So bumetanide is the right one. What prescription should the nurse anticipate? Right? Which one? We need a BMP or liver function, urine analysis, or chest. BMP to see where the electrolytes are. And now we have electrolyte. We're not going to stop the bumetanide, even though the patient is having orthostatic. That what is going to control the what? We can decrease the dose, but we don't have to stop it because the patient is in CHF. We need to give them something. And that's all we got, diuretic. That's the key. Pay attention to that. Daily pulse check before administration, right? Do you want to do that? daily pulse check. Daily pulse check before administration. Well, we want to do that. Which option is indicated? We would like to do that because of the digoxin. Avoid potassium-rich diet. They should not avoid it because the potassium is low. Add potassium supplement. Yes, they're taking bumetanide. The potassium is low, so they will need a supplement. Monitor for metabolic acidosis. Low potassium causes metabolic alkalosis, not acidosis. And then I give them sodium polyestyrene. It's going to lower the potassium. So that is not expected. So this is what we're going to do. Check the pulse because of the digoxin and give them potassium supplement. Now, which of the following the nurse should anticipate in the plan of care? We know we have hypo, patient came in back, the client was prescribed what 20 milliequivalent of potassium. However, it returned to the emergency room with what? Confusion, fatigue, and muscle weakness. Why? The potassium has gone up now, and the rest of the lab is normal. So we did hypokalemia. Now we're treating hyperkalemia. What do you do with hyperkalemia? Think about it. What are the conditions you do? Of course, we're going to get an EKG. We're going to put you on cardiac monitor. We will not need dialysis right now, but we will need some insulin. We need D50. We will need albuterol. And then why do we have to give you spironolactone? It's a potassium sparing. It's going to cost more what? Potassium. So we don't need to do that. Later on, if everything is not working, we got to consider dialysis. But I take you through hypokalemia, fluid electrolyte based on what? Bumetanide and causes orthostatic hypotension. So those are the concepts. Based on the suspected diagnosis, the nurse should anticipate which finding on the EKG. What do you see in hyperkalemia? I know you know peak T wave. Do you see peak T wave? No. I intentionally give you that. And if you don't know, write this progression down. If your potassium go up, high potassium, the first thing that will happen is peak T wave. And after that, the P wave will flatten. It becomes flat. And then your PR interval will increase before you go to the QRS widening and you go to asystole and you die. Therefore, the only thing we can see that is consistent is PR interval prolongation. This is a question on fluid electrolyte medication to help you master the concept associated with these conditions when they come to next generation NCLEX. 55. And next, provide care for a client with asthma and a new prescription diagnosis of what? Essential hypertension. Which prescription the nurse should question? This is what I tell everybody. Anybody with asthma who has hypertension and you got to prescribe medication, what for beta blocker? That's what the NCLEX is going to ask you. And what beta blocker can you use? BAM, bisoprolol, atenolol, and a metoprolol. Therefore, A is good. Metoprolol is good. Nadolol is not good. I should question. Motrin will create what? Polyp in asthma patient. Nasal polyp, bad. Acetylcysteine will create mucus in asthma patient, also bad. Therefore, what medication asthma patients to avoid? Nadolol, Motrin, and acetylcysteine. These are all bad medication that will worsen asthma condition. Therefore, they should avoid it. Number 56, and then assess the client in the outpatient mental health clinic. The client states that I have no reason to leave. This is mental health concept. I have suffered enough. I'm tired. What is the next appropriate response? This is what? Therapeutic communication. What is the problem? Ask for more. If you're not going to ask for more, keep quiet. Tell me more about your statement. I just told you. Who is going to take care of your family? Why do you care? We all have been through the cycle. I don't care about your experience. I will get you a chaplain. He asks for your help. Therefore, ask for more. And next, and the UAP provide care for a client with acute myocardial infarct, which intervention is appropriate for the UAP to delegate to, for the nurse to delegate to the UAP. The only thing you can delegate to your UAP, I said pick two, is anything that does not require thinking and does not require assessment, anything, or is ADL, nothing require thinking. Based on that, which one are you going to choose? Let me know. Reinforcement, that's LPN. Monitor client pulse, A. All I do is check a pulse. That's not difficult, right? But I'm monitoring, the word monitoring is not consistent. It's not supposed to be monitoring. All they do is take vitals based on this protocol. They can do that. Replaced client sequential compression after ambulating. Well, if you work, I place it back. No. Evaluate client chest pain quality during vital check. No, you should not evaluate, you should not monitor, you should not reinforce. Use the adjective to help you do easy, straightforward delegation. That's the key. And then assess a 12-hour newborn admitted to the nursery, which finding require immediate notification to the healthcare provider. Which one is abnormal? Bluish discoloration of extremities, acrokinosis, 2 centimeters umbilical hernia. There's a whole umbilical, right? A pulse of 100 beats per minute. What is the baby heart rate at 12 hours? What do you expect? This is classic. Respiratory rate of 30. I want you to master this. This is a straightforward question. It's hard, critical thinking, concept-based, right? Acral cyanosis is normal. Umbilical hernia expected. Now you're left with this. Baby heart rate is 110 to 160. You see? Hypertension. And respiratory rate, no. That's bradycardia. Respiratory rate is what? 30 to 60. That's good. Therefore, what are we going to do? I'm going to be worried about our patient who has what? Pulse of 100. And that's my patient. How are you doing so far? I know you know this. 59. Almost there. We're going to end at 67 due to the case study. So those are, I calculate all of them at 67, you're going to be done. And then it's assessing an adult client on message word, which finding is concerning. Selected apply. Use of accessory muscle. Pulse of 135. Hoarseness. Warm feet. Capillary refill greater than 3 seconds. Pulse of 85. What do you think? Patient is the med-surg unit, and you seen checking these vitals. Which one should be concerning to you? Accessory muscle, respiratory issue. A pulse of 135, your adult should not go that far. Tachycardia. Hoarseness is airway. If your feet is warm, that's good. Capillary refill greater than 3 seconds dehydration. Your pulse is 85 if you have no any other medical condition. But this is not to trap you. If it's normal, normal. If you know it, pick it. If you don't, leave it alone. And then review what? 60. Question 60. You have 7 more left. Question 60. Pat yourself on the back and you say, I made it to 60. What is your concern right now? How are you doing? What is your score? How are you faring? Most missed NCLEX practice question, NCLEX review question, NCLEX questions and answers for the next generation. And let's review care needed for several clients. Which client is the most appropriate for the nurse to delegate LPN? Reinforce, MMR most. Monitor, most medication, reinforce, special test, they can do all. The client be admitted for pneumonia, you need initial assessment, no. A client being discharged after treatment of Clostridium, No, you need better teaching. You don't teach people, you just reinforce it. A client with metastatic colon cancer being transferred to hospice, you have to give a report. You're not responsible. A client with malnutrition requiring gastrostomy tube, you do 2 feeds, you can take care of it. MMR most. And then provide care to several clients involving motor vehicle accident. Which client would the nurse assess first? Multi-trauma. Who do you see first? Who do you see first? Who do you see first? Anybody with the chest wound is number 1. Anybody with what? Shock, number 2. Airway. And for a client with 4 air laceration, GCS of 12, you may have brain injury. I don't know. A client with chest wound, hypotensive, and tachycardia is in shock. That may be my favorite person. A client with traumatic amputation by his pulse is fine. GCS 15 is not in shock, even though he has lost some blood. A client with fixed 6 millimeter pupil, blood pressure is that 190 and a pulse of 40. That's herniation. You're dead. Despite your bad condition, you're not going to make it. Unfortunately, we're not going to pick you. The one we're going to pick is that. That patient is in shock. 62. And let's provide care for a client with what? Hypertension. Client experiencing nagging cough, hypertension cough. The nurse know that the cough is associated with which medication? Enalapril, losartan, amiodarone, and ethambutol. What do you think? Nagging cough usually is enalapril. Even though amiodarone can cause cough, it's different. It's not nagging. That is a bad problem. And because of that, they said the medication should be switched to. Amiodarone cough is pulmonary fibrosis, and therefore you can be switched to anything. That's why enalapril is the best answer. And therefore we switch it to what? Sartan, low sartan group, candy sartan. These are ARBs. That's what we're turning to. Okay. 63. And nurse is assessing a client in emergency room with what? Traumatic brain injury with GCS of 9. Which prescription should the nurse anticipate? Bad head injury. Lower the ICP. Which of them lower the ICP? It's no morphine. It's going to depress the central nervous system. Metoprolol will lower the blood pressure. Metanoganovin will worsen the condition. Give them mannitol, and that would lower the intracranial pressure and help with that. And nurse is aware of 4 clients at change of shift. Would you when you see prioritization 101? A client who had cholecystectomy 5 hours ago, right apocarabine. A client who had right pneumonectomy 5 hours ago is positioned on the left side. A client with the total abdominal hysterectomy 5 hours ago, positioned in the semifilar. A client who had what? Kidney biopsy 5 hours ago in supine position, who need to be seen, whose situation is not expected. If you have kidney biopsy, we should put you on your back. That put pressure. Total abdominal hysterectomy 5 hours ago in position in semi, so to improve your lung function. If they remove the right side of your lung, pay attention, write this down. Right pneumonectomy. So if this is your lung, and we remove all of this, there's nothing here. That means we got to let this, we got to make the left lung mature. We should put you on the place, on the side, there is no lung. You should be on the right side, not on your left side. If you stay on your left side, the left lung is going to also collapse. If you have cholecystectomy, you're going to have right shoulder pain. Therefore, 5, number 2 is the right answer. It's very, very important that if you have pneumonectomy, remove the whole of the lung, don't place them on that side. If you remove half of the lung, place them on the unaffected side. But if you remove all of them, place them on the affected side. 3 more questions. And let's provide care for a client with suspected active TB for 4 weeks of night sweats, weight loss, and cough. He has suspected TB and he's having all these symptoms. Matter test is positive. That means he has active TB. Which prescription the nurse should anticipate from the healthcare provider? Repeat the TB test negative. Do quantiferum test already positive. Determine BCG level is negative. We got to check for 3 mornings to sputum culture for 3 consecutive days. Why? Just because your PPD is positive, since you have symptoms, we got to confirm. Confirmatory tests require sputum culture, and therefore this is sputum culture. 66. Are you afraid? Another case study, but I know you got it. 17-year-old female. What is going on with the patient? 2 days of nausea, right? Right lower quadrant pain. What do you think? Is he appendicitis? Forget about it. Chills. No sick contact. It's a female. Worry about something. His last menstrual period is what? 1 week ago. No episode of pain. Never had his. He already had his menses. No bowel movement. No urinary symptoms. He's sexually active. He doesn't take contraception. He's febrile 200. Tachycardic. Blood pressure is fine. You examine, the abdomen is distended but soft. He has tenderness at McBurney's point. So he has right lower quadrant tenderness. No bruit, and his spleen is fine. 17-year-old female with right lower quadrant pain, but he had his menses 1 week ago. The nurse reviewed the clinical data. Which of the following diagnoses should the nurse suspect? Put everything together. Do you think this patient has appendicitis, ectopic pregnancy, cholecystitis, and diverticulitis? It's not cholecystitis or diverticulitis. It's between A and B. Why one is not? If it's ectopic pregnancy, I will give you information about bleeding. I never give information about bleeding. There is no information about bleeding in this question. I told you you already had menses. Therefore, it cannot be. Therefore, it cannot be what? Ectopic pregnancy. All the same symptoms and pain at the McBurney's point, this is consistent with appendicitis. If this is appendicitis, it's a GI problem. Every GI problem, you're going to be NPO. When you NPO, you get an IV fluid. If it's an IDs, you get antibiotic. If you have IDs, you're going to have pain management. We're not going to discharge you now. The patient now had surgery. Which of the following the nurse should include in the plan of care? After you have surgery, well, you can get some clear liquid. You can get out of bed. No bed rest. We can give you SCDs. We can monitor your pain. Classic GI question. Which teaching at discharge is appropriate? You're going home. You should take shower daily, take bath daily, no weightlifting restriction, follow up as needed. What are you going to do? You should take shower. You can't tell them not to take shower. They should have weight limiting restriction. They can't take bath, okay, for 6 weeks. They shouldn't follow up as needed. The client present 3 weeks later. 3 weeks, this I came in with what? Right lower quadrant pain. The same pain. Well, I thought we remove your appendix. No nausea, no vaginal spotting, right? So the client present 3 hours. The client present 3 weeks later with what? Right lower quadrant pain. There's nausea. There's vaginal spotting. Oh, we have a trouble. We remove your appendix. Now you come in again. Nausea, right lower quadrant pain, vaginal spotting. Temperature 99. The heart rate is 110. Blood pressure you can see is low. Tachycardia. Patient is in shock. What do you want to do? What is your priority for this particular condition? You get a CBC, BNP, urine culture, or pregnancy test. I think we need to know if you're pregnant. Pregnancy test, and that will prove that you may have ectopic pregnancy. Based on a diagnosis, prioritize the following in the plan of care. We know this is ectopic pregnancy. If it's that, I have to give you 2 large bowl IV because you're going to be in shock. I'm going to type and cross you in order to get more blood available. What else do you think you should do? We should give you the blood because you are in shock. We should get a CT scan. Then we consent you for surgery and you go in surgery. This is the way it will go based on the patient condition. And this is appendicitis evolving into what? Ectopic pregnancy. And the last question, 85 question, adapt in class. Thank you for watching. If this video helped you, this little hashtag in the comment section saying I made it to the end, or I watched halfway, I'll come back halfway. Hashtag I watched this 85 question, most likely mixed questions. And then scale for a client with what? 33. And then scale for a client with stage 3 sacral DQ ulcer due to immobility. It's not moving around. The next morning assessment shows a swollen, red, and tender to touch calf. Patient does not move, is swollen and tender to touch. That's DVT. What do you want to do? Let the doctor know. Assess for pain with passive dorsiflexion of the foot of the affected leg. Request a prescription for what? Thenzaparin, and place what? SCDs on. What do you want to do? Yes, DVT. If you're taking care of this patient, what would you do? I know they will need prescription. I know they need the SCDs. You don't need to do any more assessment. This is diagnostic. You should let the doctor know so that they can decide what they want to do. Thank you for watching. 85 questions, English practice question, English questions and answers, English review questions, talking about every system possible, available, simulation like the English 85 question. Thank you and hope you get something out of it. If this video helped you with your English prep, just click on the like button and put a like comment. Let us know how you're doing. Take care and good luck in your exams. Bye.